Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio-Menard. The respiratory syncytial virus, or RSV, is a common virus that can cause a common cold that can be treated at home, but it can also lead to more serious respiratory infections such as pneumonia. We're at the beginning of RSV season, and we're hoping not to repeat last year's severe surge of RSV that filled children's hospitals in West Virginia and around the country. And this year, there are new RSV treatments available that could make a big difference in preventing and lessening the effects of RSV. So what are the symptoms of RSV? How do you treat RSV? And how do you prevent it? We'll answer those questions and more as we're talking with Dr. Jeffrey Lancaster, Associate Chief Medical Officer and Pediatric Hospitalist Medicine Chief at WVU Medicine Children. Welcome, Dr. Lancaster, to Tuesday Talks.
Thanks for having me, Mary.
Well, it's good to have you here. So let's start with the basics. What is RSV and how is it spread?
Okay. RSV is a virus. It stands for, as you said, respiratory syncytial virus. And it causes infection of the upper and lower airway. So it is spread when we cough and expel droplets into the air, and it lives in those droplets. So most of the time it is coughing onto a hand or onto a surface, and then the virus can live on that surface for hours.
Oh,
and
great.
then we come by and we touch the surface and we don't wash our hands, and then later we're sitting around having a deep thought or something and we touch our face or our eye or mucous membrane, and then it can get in through there.
All right, so it's tricky.
It's tricky.
Now, after last year's RSV surge, that was a big one.
It was.
What's the outlook for the RSV season this year?
It's a little bit difficult to predict. So last year was an unprecedented year for RSV across the nation. So when we look at last year, we lagged behind the South about 1 month when we look at the CDC curves. And so learning from that, we're trying to do the same thing this year. So if I look at Georgia, Tennessee, they started peaking in around August. And so we're thinking about any time now we're going to start seeing some more RSV. We've seen a couple sporadic cases here and there so far, but nothing like last year. Last year when it started, it was happening around us a lot. So Virginia, Maryland, in the South. So we were getting calls from, and this is when we opened our new children's hospital. It was just started off with a bang. We were getting calls from all of these places to transfer us kids that they couldn't take care of because they were at capacity, places we'd never gotten calls from before. And so, we were happy to take care of it, and all of a sudden our population took off with RSV. And then as we took off, thankfully some of these other places started going on the downslope. So what we learned last year was we were a month to 6 weeks behind them, and so we're thinking we're probably in the next week, 2 weeks is probably when we're going to start seeing some more cases.
All right, so you haven't seen anything big yet?
Nothing big yet.
Okay, all right. So what are the symptoms of RSV?
Yeah, symptoms can range from a common cold to really what we call viral pneumonia. So RSV causes what we call bronchiolitis. So bronchiolitis is, when you think about the airway, you have the trachea, the windpipe, then it splits into two bronchi, and then multiple small little straw-like bronchioles. So it causes infection there in bronchioles. So it causes cough, congestion, wheezing. It causes upper airway congestion, so you can get sore throat, stuffy nose, runny nose, and then cough, congestion, wheezing. So it causes a little bit of both.
Does it tend to be worse in babies and young children?
Absolutely does, and for a couple of reasons. One reason is because they don't have any immunity to it. And so, I've had RSV, as a pediatrician, I've had RSV. How long have I been practicing? That times that. And so, if I'm exposed to it, I get pretty mild symptoms, like most adults. Babies, especially the first time they get the infection, well, they don't have a way to fight it off. And so their symptoms are more severe. Their airway is smaller as well, so all of the inflammation in their airway, it takes up more space, so it's just harder for them to breathe.
Wow. So how do you treat RSV then?
RSV is frustrating. There's not a cure for it. There's not a medicine for it. There have been multiple antivirals tried without any real clear success. So treatment of RSV centers on what we call supportive care. So if a baby is dehydrated, they need IV fluids. If a baby's having low oxygen saturations, they need oxygen. But what we really focus on is fever control. When you have a fever, you breathe faster. Everything is kind of revved up. So taking care of fever, so a baby who's already working hard to breathe doesn't breathe faster because of the fever. So Tylenol, ibuprofen, things like that. And then nasal clearance. Babies are what we call obligate nose breathers. So they are programmed to breathe through their nose instead of their mouth. And RSV causes just a whole lot of sinus congestion and nasal congestion. So really using a sucker or something to get I'll just say snot out of their nose, so that they can breathe through their nasal passages. So we really focus on just supportive treatment for RSV while it runs its course. And we know that's a frustrating thing for parents to hear. I'm a parent, and when you hear something has to run its course, it's like, man, don't we have a better thing for that? But for now,
never any fun.
That's kind of where we're at.
Okay, but we do have some new treatments for RSV this year. What are those new treatments?
It's very exciting. So there is a new, recently approved by the Food and Drug Administration, the FDA. It is called nirsevimab. It is a type of medicine that belongs to a category called monoclonal antibodies. So we all have antibodies that we make on a daily basis. So if we have a bacteria or a virus that our immune system sees and says it's not supposed to be here, we make antibodies against it. And those antibodies can attach to that virus or bacteria and neutralize it. So monoclonal antibodies are made scientifically against a specific part of the RSV virus, and it's against the fusion protein. The fusion protein of the virus allows the virus to attach to our cells and then gain entry. So this nirsevimab goes and coats that fusion protein so it cannot attach to our cells and get in.
Oh, okay. So this would be for the babies then, because they don't have the antibodies, and
Correct.
But you're essentially giving them the antibodies.
Yep, and one of the things that made last year's RSV season so difficult was these babies were, most babies before this are born with some immunity to RSV because their moms would have had RSV infections and been able to give those antibodies to the baby through the womb. But with the theory is that one of the reasons why last year was so bad was that we, due to COVID, we were all spread out and we were all masked and we were all really good about washing our hands. And if you think back, a lot of us didn't have colds for a year and a half. And so the moms may have had less antibodies to give to the babies, so the babies came and didn't have any immunity. And then also the 1-year-olds who missed RSV season didn't have any immunity for this season too. And so the antibodies, this replaces those antibodies that were missing for a year or two.
Okay, well that makes sense. That makes sense. So the new RSV shot, is that strictly for babies under 8 months old?
Yeah, so it is, and the thought is that after you turn 8 months, you're going to have had RSV and have your own immunity at that point. So the FDA limits it to starting in RSV season, which is defined as pretty much October 1st, so now, until you turn 8 months old. And that's really until about April was when we think RSV season kind of starts winding down. So if your baby is going to, on March 31st, is 7 months and 30 days, it's okay to get it because it still protects you for what we know RSV can go into April and sometimes May.
Oh, okay. Well, it's good to know that. But there's still an RSV vaccine for adults and older children too?
For adults.
Just for adults?
Yeah, just for adults.
Okay.
And there are two types. There was one that's approved for 60 and older because the adults also had a rough time with RSV last year. Not on the scale that the Children's Hospital did, but also there were a couple years where all of our immunity to RSV went down just because it just wasn't circulating because we were masked and moved apart. So there's now this RSV vaccine for adults. There's another one, it's a different vaccine for pregnant women that has a recommendation from the FDA or approval for the FDA between, I think it's 32 and 36 weeks. And so what the thought is the mom gets the vaccine, starts making antibodies, and those antibodies, by the time the baby comes out, antibodies go from mom through the womb into the baby. So the baby is born with some antibodies.
Oh, okay. And that's one of the new ones?
That's one of the new ones. Yep.
Wow.
It's
okay.
still awaiting recommendations from the Centers for Disease Control. So we'll be seeing those probably pretty soon.
Okay. Okay. So how effective is the new RSV shot of monoclonal antibodies for babies?
So when they've tested it, it looks to be very, very effective. It drastically reduced a metric they call medically attended RSV. So what that really is RSV where you had to take your baby in to see somebody. So it dropped that. It dropped the amount of babies that needed to be hospitalized for RSV. So it is just based on this really well done study published in the Lancet, it is a very effective treatment.
So who should be getting this RSV shot, the new one for babies?
We would recommend it for every baby.
Really?
Yep. So there are, every baby born during RSV season. So starting now through March, probably April. And so you'll hear, at most hospitals that you're going to be at, you'll hear your pediatrician talk about it and say, there is something that can protect your baby from really severe RSV. You will still get RSV. You'll still be exposed to it, but this can really blunt the symptoms, and then your baby will get the benefit of getting some RSV virus, but not getting bad symptoms, but making their own antibodies to it as well.
I mean, because symptoms in babies can be life-threatening.
Absolutely. We have seen, you can see babies with just really bad difficulty breathing, right?
Yeah.
So what we call retractions, working hard to breathe, nasal flaring. And we saw a lot of that last year. And so the symptoms of RSV can go, there's a big spectrum from very mild to very, very severe.
Wow, good to know. So when should we get the RSV shot for our babies?
So,
and go ahead.
Oh, okay, yeah. For some babies, we're going to recommend that they get it while they're in the nursery before they leave the hospital. And these are babies who are premature, babies who might have heart disease, babies who might have chronic lung disease. Those are the ones that we think are at high risk for, again, if they get RSV versus a full-term baby with RSV, full-term baby has a better chance of doing okay. So the ones that are at high risk for bad RSV disease, those are the ones we want to make sure that they are protected from the get-go. Okay. The babies who are term and healthy and doing well, we recommend at their first visit after being discharged from the hospital. So that's usually like day 2 or 3 of life.
Okay, but this is not for children over 8 months old.
No, there's a small subset of babies who can get it in the second year after they're 8 months old, and those are those high-risk babies with heart disease, lung disease, and some prematurity.
All right, well that makes sense. All right, so we're talking about the shots and everything, but along with the shots, how do you prevent getting an RSV infection?
Yeah. Well, we learned one way to prevent getting it was social distancing and masking. I think we're past that now.
Yeah.
So what we want to go back to is just really good hand washing, right? So using alcohol-based sanitizers or washing your hands for 20 seconds and singing country roads while you do it. So taking really good care of keeping your hands clean. Because if I sneeze and I immediately clean my hands and I put them on this desk, I'm not going to, put this on this RSV on the desk for somebody to pick up later. On the other hand, after you touch it, you don't want it. And then after you touch it, just making sure you're keeping your hands clean. If you have, if you sneeze into a tissue, throw the tissue away into your corner. One thing we always watch out for, when we hold babies, their heads go right there in the crease of our elbow. And so that's something we'll often tell a parent, because even my children have been taught since they were in daycare to sneeze like this.
Yeah.
And then I just say, if you're going to hold a baby, just remember, don't sneeze right here, because that's where their head goes. I
just became a grandma. I'd never heard that. I never thought of that. So that's really good advice.
Congratulations.
Well, thank you. So should the RSV shot be given every year like the flu shot for adults?
That is a good question. I do not know the answer to it. That is something I'll have to get back to you.
We can find that out.
Okay.
You can get back to us on that one. So if we suspect our child has RSV, when should we take the child to the doctor, our doctor, pediatrician, versus taking them to the emergency department?
Yeah, letting your pediatrician know is never a bad idea. But I would say mild symptoms, so cough, congestion, but your baby is not dehydrated. They're still eating. they're not working hard to breathe, that's okay to give your pediatrician a call and have them come in. If your baby is really refusing to eat, is not peeing well, or if you see what we call respiratory distress, and so that we start at the top, looking at the nostrils. If the nostrils are flaring with every breath, that's a sign. If you see this area kind of sucking in every time they breathe, or between the ribs or under the ribs are sucking in, if they're breathing really fast, those are all reasons to go to the emergency department and have your baby evaluated, because they could have low oxygen, they could have high carbon dioxide. So there are things that, those are things you definitely want to have evaluated.
Err on the side of caution?
Absolutely. We have a wonderful new pediatric emergency department.
We do.
Yep, it is beautiful. It has pediatricians who are trained in emergency medicine, so they have been taking care of kids their whole life. And so that's who you want to go see.
Okay. I know that, you know, you're pediatric medicine, but I just wanted to just talk a little bit. Adults can get RSV too.
Absolutely. Yep. And
but we don't get it as severely.
Yeah, we really get mostly colds, cough, congestion, a little bit of sore throat, and so we get through it okay. Our airways are bigger, and so we kind of tolerate that a little bit better. In the babies, one thing that doctors that we overdo a little bit is we give things like albuterol to babies with RSV, which we really shouldn't be doing. And our big excuse is, so there's wheezing, which is caused by asthma, and it responds to albuterol, like the inhaler or the breathing treatments. And that happens because in the airway, it is lined by smooth muscle in the middle. And if you have asthma, that smooth muscle gets irritated and clamps down. Albuterol opens it up, so the wheezing goes away. In bronchiolitis, we hear wheezing, but the smooth muscle is relaxed, it's open, but the inside is just like our nose. It's full of snot and inflamed mucous membranes. The albuterol doesn't do anything to change that. You can see like just a couple minutes of improvement after an albuterol treatment with a baby with RSV. That's mostly because you've made them mad, and they're crying and screaming and coughing, and they're clearing that stuff up a little bit. And so we don't recommend it because albuterol is not, it doesn't come without side effects because it causes high heart rate and agitation and jitteriness. So we've kind of learned over time that, you know, that doing less is sometimes more. So keeping fever control, keeping your baby hydrated, keeping oxygen sats up, and then sucking out the nose.
Okay. So can you talk just a little bit about, I mean, our children's hospital is 1 year old. Can you talk a little bit about the expertise of the team?
Absolutely.
You know, not only for taking care of RSV, but, you know, a lot of other conditions.
Yeah, so, you know, RSV, I think we proved it as we moved in last year. As we moved in is when West Virginia got hit with this big RSV surge.
Baptism by fire.
It absolutely was, you know, and I'm a bit of a romantic. I think I look back and I think, you know, it was hard, but not one baby in West Virginia, as far as I know, died from RSV last year.
Oh, wow.
And it's it's not just a huge accomplishment for our children's hospital, it's a huge accomplishment for the state of West Virginia and the WVU Medicine Health System, because our regional hospitals and even our community hospitals were taking care of sick babies. You know, so we had 3 times a week Zoom meetings to kind of go like, hey, what's your situation? What can we do to help, while we were full and you know, they were taking care of kids. I'm sorry, I got carried away talking about that.
Well, we're just talking about the experience of the team at WVU Medicine Children's.
And so we have really, since the building has opened, you know, our recruitment has continued to go and go and go. You know, this building is, we've always done a good job recruiting because, you know, this is a great place to work and live. And now we have this great, big, beautiful building also. And so we have every specialist. You know, there's not a specialist that we don't have. And we have really grown our surgical program. So general surgery, so led by Dr. Federico Seafarth. You know, they do every surgery, you know, that a general pediatric surgeon would do. We have pediatric plastic surgery, we have heart program, we have airway from ENT, so we have pediatric orthopedics, we have 4 peds orthopedics doctors. So it's really turned into a robust children's hospital.
You don't have to leave the state of West Virginia to get the best kind of care.
You do not. And I'm a West Virginian, right? And I want to be taken care of by my people, and we are your people.
Oh, that's great. That's great. So Before we wrap up, I want to ask you, what's the most important thing you want parents to know and remember about RSV?
Yeah, well, it's frustrating. I think that's probably number one. It is super frustrating, but it is. There's a way through it. Unfortunately, we don't have a great cure for it, but we do have treatments to kind of help get through. And so at home, keeping the nose clean, keeping your baby hydrated, and taking care of fevers, taking your baby in to be seen when they need to. It is a viral infection, and so antibiotics don't help. So if your baby has RSV bronchiolitis, antibiotics aren't going to help, and they potentially cause harm. And so that's something that is sometimes doesn't make a lot of sense. And doctors also offer antibiotics when we shouldn't. And so, hold us to it. If we are offering you antibiotics for RSV, just question us a little bit, and we'll come around.
Because it's a virus.
It's a virus, yeah, it's a virus. And antibiotics in a baby's digestive tract sometimes just don't go well.
Oh, okay. All right, good to know.
Yeah.
Well, thank you so much for sharing this information with us today. Now we're armed and dangerous for RSV season.
Absolutely, we're ready.
Hopefully it'll be lesser than last year.
With any luck, but if it's not, we have a great squad ready to take care of you.
All right, good to know. Thank you.
All right, thanks, Mary.
Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about WVU Medicine Children's, just visit wvukids.com. And join us on the next Tuesday Talks on October 17th, when we'll talk about microsurgical breast reconstruction surgery with WVU Medicine plastic and reconstructive surgeon, Dr. Mahed Malouf. I'm Mary Ravazio Menard, and on behalf of Dr. Lancaster and everyone at WVU Medicine, thanks for joining us.